Let's listen to an expert doctor for hypertension in young population along with coronary artery disease and higher heart rate. Can be sure of happy heart? Today we have Dr. Karthik, DM Cardio People Tree Hospital. Can high blood pressure be completely cured?
That's an interesting question. See, hypertension is of two types. One, the primary or essential hypertension, which is seen in about 90% of the patients. Number two is secondary hypertension, which is seen about 10% of the cases. If you go back to the question of can hypertension be completely cured, in case of primary hypertension, yes, it cannot be cured, but however, it can be controlled with good diet and lifestyle modifications and regular medications. However, in the 10% of secondary hypertension cases, it can be cured if the primary cause or inciting cause has been identified and treated. For instance, in certain patients, there can be a reversible kidney problem which would have led to hypertension. Or in females, they may be having a polycystic ovarian syndrome which might have caused the hypertension. Sometimes there may be problems with the adrenal glands or the thyroid gland which can also cause hypertension. Or in patients with obesity, morbid obesity and obstructive sleep apnea, that itself can result in hypertension. So when some of these primary inciting causes are attended to, the secondary hypertension resolves or get controlled.
What is the relevance of heart rate in hypertension?
Heart rate is a very important factor in the management of patients with hypertension. And studies have shown that heart rate itself is an independent risk factor for heart attacks and brain strokes and total mortality in patients with hypertension. So it is very important to keep in mind on controlling the heart rate in patients with hypertension.
What precautions should a patient take along with medications?
The hypertensive patients definitely should resort to their regular medications and regular clinical follow-up with their physicians so that they can know how effective their blood pressure is controlled. Apart from that, there is a great deal of commitment required from every individual regarding control of their hypertension. For instance, they should be very strict with their adherence to diet and lifestyle practice, regular exercise, avoidance of unhealthy food and lifestyle practices, adequate sleep, quitting of smoking, alcohol, completely cessation or in moderation, weight reduction. All these things would help the patients to have a good control of blood pressure. And not only that, many a times patients are not regular with their medication. So adherence to regular medications also is very much essential in patients to keep their blood pressure in control.
Thank you, doctor, for your time.